Hi there, my name is Alan. I'm a student physical therapist at the University of St. Augustine. How are you doing today?
Good.
Okay, so I understand you're coming in for some trapezius pain right up here. So I wanted to use a modality called ultrasound to go ahead and kind of address that situation. But before we continue, can you please tell me your name, today's date, why you're here, and where you are?
Yes, my name is Dayton Tomita. It is March 16th, and I'm here at the University of St. Augustine. And I'm here because I have some pain in my upper trapezius and some little bit swelling.
Okay, perfect. Also, before we begin, I'm just going to do a quick skin inspection just to make sure everything in that area is okay. All right. Okay, looks okay to me. Okay, and then just to make sure that you have intact sensation, I'm just going to have you close your eyes and tell me when you feel a sensation on your trapezius. Okay.
Yep. Yep. Yes.
Okay, excellent. All right, so we have the patient currently draped right here with a pillow under his arm to maintain that loose pack position. All right, and so we're going to be using the ultrasound modality. Right here I have a large base head at around 10 centimeters squared. I'm going to be placing the frequency at 1 megahertz right here to address the fibers of the trapezius, which are large and broad. So I want to go ahead and reach the deeper fibers to address the swelling. For the duty cycle, since the patient is in a subacute stage, I'm going to put it to at 50%. All right, and then I'm going to go ahead and start the machine after I apply the gel onto the head, and then applying this on the patient's skin. Are you doing okay?
Yep.
Excellent. Okay, at this point I will start the machine. And at this point I'm going to ramp up the intensity to 1, also within the subacute parameter. And then for this point, I'll go ahead and set the time to 10 minutes. You're doing okay?
Yes.
Excellent. So we're going to proceed with this modality for the next 10 minutes. And so now we're going to go ahead and ramp down and stop the machine. And at this point, I will go ahead and take the head off of the patient. I'll go ahead and wipe the patient down. How are you feeling?
Better.
Better? Excellent. Glad to hear that. And then at this point, I'm going to go ahead and do another skin inspection just to make sure that there were no burns or any sort of wounds attained during this modality treatment. And everything seems to be in order. So finally, I'm going to go ahead and remove this and this. We're going to do a sort of intervention to go ahead and complement what we just did. In this case, Dayton, I want to do a sustained stretch of the trapezius, all right, to address kind of the swelling and the pain. And hopefully, with this continuous exercise, it'll reduce the symptoms in that area. Is that okay?
Yep.
So for this, I want you to go ahead and nose to your armpit. Go ahead and look down to your right side. Excellent. And I want you to use your right hand. Go ahead and place it on top of your head and hold that. Go ahead and pull down. You feel that stretch in this area right here?
Yes.
Excellent. So I want you to hold that for about 15 seconds, and we're going to do it about 10 times. And this will be a great home exercise program that the patient can utilize at home whenever the time arises.